Hello all, in this video we'll have a quick discussion on the cardiovascular system changes in pregnancy. So let's discuss each change one by one. The first one is cardiac output. During pregnancy there is a 30 to 50% increase in cardiac output. And the reason for that is the increase in estrogen level. So estrogen level is increasing throughout the pregnancy, right? So when estrogen increases, this estrogen it can act on the kidney and it can increases the reabsorption of fluid in the kidney. So what happens when fluid reabsorption increases in kidney? There is increased fluid volume in the body. And when there is increased fluid volume in the body, that increases the return of the blood into the heart. That means preload. So preload increases. So when preload increases, it leads to increase in stroke volume and ultimately leading to increased cardiac output. That is how cardiac output increases in a pregnant woman's body. Then here we have to mention another term, that is physiological anemia. So pregnancy is a state of physiological anemia. The reason for that is the increase in the fluid volume. So fluid volume is increasing 30 to 50%. But according to that, there is no increase in the red blood cell count or HP level. So in a non-pregnant woman, the hemoglobin normal range is 12 to 16 gram per deciliter. But in a pregnant woman, the normal range is 10 to 14 gram per deciliter. That is because of this physiological anemia. So I hope you got the reason for physiological anemia. The next change is heart rate. So during pregnancy, there is an increase in heart rate. And next is blood pressure. During pregnancy, the blood pressure decreases. That is because of the action of progesterone. Progesterone, it decreases the systemic vascular resistance. So systemic vascular resistance, when it decreases the blood pressure also. But it is only seen in first trimester. By second and third trimester and all, it becomes normal, and this decrease in blood pressure is not that evident. There will be only small drop in the blood pressure. And the next two changes, that is because of the compression of the gravid uterus. So as pregnancy progresses, there will be a compression of the gravid uterus on the blood vessels. So that can result in two important changes. The first one is varicose veins and peripheral swelling, and next one is supine hypotension syndrome. So varicose veins and peripheral swelling, that is because when the gravid uterus is compressing the inferior vena cava, what happens is the blood is not able to return back to the heart. So there is pooling of blood in the extremities, leading to peripheral swelling and varicose vein. And next, supine hypotension syndrome. Because of the decreased preload, the heart is not able to effectively pump blood to all parts of the body. So women who stay in a supine position for a prolonged time can experience symptoms like dizziness, syncope, etc. So that is supine hypotension syndrome. So these are the important cardiovascular system changes during pregnancy. It can be asked as an answer briefly question. So I hope you understood the topic. Thank you.